My name is Nyah Miranda, and I'm a fourth year student at the New England College of Optometry. I'll be moderating our future focus group chat. It's a real conversation about what it looks like to transition into optometric practice back in Canada. I'm joined by two special guests whose perspectives I know will be especially helpful. First, Dr. Scott, current president of the Canadian Association of Optometrists, a 2006 graduate at the University of Waterloo. Dr. Scott has practiced in the Halifax region for nearly 2 decades, providing comprehensive eye care and brings extensive leadership experience through her long-standing involvement with the Nova Scotia Association of Optometrists and, of course, the CAO. Second, Dr. Baillie, who was also born and raised in Halifax and graduated from NECO recently in 2025. She has since returned home to provide comprehensive eye care with a special interest in specialty contact lenses, supported by advanced training across Canada and the US. She also previously served as the president of the Canadian Association of Optometry Students at NECO. So here's how we'll run this session. I'll start with a question, and then we'll open it up for a broader discussion and audience participation as time allows. Please use the Q&A icon at the bottom of the screen, and we'll get in as many questions as we can. All right, let's start with Dr. Scott. The first question. For Canadian students training in the US, what steps would you recommend taking during optometry school to make the licensing and transition process back to Canada as smooth as possible?
Great. Thank you for having me. This is a great opportunity and such a wonderful time to bring everyone together, who are studying optometry across North America, particularly in the US. So certainly, first thing I would say is become a
Everyone's in
member.
the diaper bag.
Become a member of Chaos, which also become a member of CAO, and for a few reasons. It's a great resource to get as much information as possible. And also, CAO has a job board, so when you are looking for that employment, you can actually access as a member our job board online. And then use your resources, use events like this. This is a great opportunity to learn information. I learned a lot about immigration, which I hadn't had to experience, but learning, taking these opportunities when they come along, using the OAB resource that we're going to hear from later, just trying to get as much knowledge as possible.
Awesome. Thank you so much. All right, now we'll go to Dr. Baillie. What was your biggest clinical or professional adjustment when you began practicing in Canada versus your US training?
I think this is a great question to start with. And in the spirit of making my answer to this as practical as possible, because that seems to be a theme of the evening tonight, there's really three aspects that kind of surprised me when I transitioned to practice in Canada. And I'll start by really just addressing the way that we measure visual acuity. So in the States, we use kind of the standard 20 feet as our visual acuity standard, but in Canada, 20 feet is equal to about 6 meters. And so often in charts, whether that's from fellow optometric colleagues or referral letters from ophthalmology, or even when I'm filling out paperwork for some occupational related vision concerns, I'm asked for their visual acuity notation in 6 meters. And so really, I find myself kind of going back and forth between what 7 over 7.5 really means, and doing that conversion in my head. I've gotten a little bit more comfortable with it over time, but at first I really had no concept of what that measurement meant. And that was one thing that I found to be quite different and something that you're likely to encounter if you come back to Canada. And on a similar note to that, the way that we quantify patients' blood sugar is a little bit different in our diabetic patients. So thinking back to my days memorizing what qualifies as diabetic, controlled versus not, those numbers that I had in my head were in the units of milligrams per deciliter, and that is the standard in the United States. But then when I came back to Canada, patients were giving me numbers that didn't really make a lot of sense. And the more that I encountered this problem, I realized that Canadians, our standard is to measure blood sugar in millimoles per liter. And there's some easy ways to convert back and forth between those two, but I think it's important to A, know that there's a difference, and B, be fluent in going back and forth between those two, just for communication with patients and also being able to provide interdisciplinary care with both family medicine and ophthalmology. On the other hand, both countries use A1C expressed as a percentage, so that doesn't change. And maybe this last point goes without saying, but there's differences in drug availability in Canada. Some of the newer eye drops or treatment modalities that you'll learn about at the big American conferences, or even that come up in your education in the States, are less likely to be available in Canada. So it's important to check and just make sure before making any recommendations to your patients. So that said, those were a couple of things that I cherry picked from the last couple of months of practice. But overall, I feel like the American optometric education that I had in Boston prepared me very well to practice here.
Oh, that's good to hear. And good point about the meters thing. I hadn't really thought about that. So I'll remember that for when I start practicing. Okay, we'll move on to another question for Dr. Scott. What advice would you give to students or new graduates who want to get involved in professional leadership, such as your journey with becoming the CAO president?
I think the easiest one is, just do it. Don't be afraid to put up your hand. I think sometimes as a new grad or a younger doctor, we feel like maybe we shouldn't get involved. But I will say my experience has been that, your new grads, your students have such a fantastic perspective to bring that we want to hear that. So your associate students want you to be involved. We want to hear your opinions. And sometimes it can seem daunting. You're learning how to practice, you're learning how to convert, meters to feet. And it may seem like a lot, but there's a lot of opportunities that, you can do a video for the PR campaign, or you can sign up for the committee. You can start small. You don't have to just jump on council year one, but, start small, get involved, but don't be afraid to put your hand up, because we do, your opinion is really important and it's valuable, and it's really great to share it, because you have a lot more years of practice ahead of you than I do. And so that's really, really important.
Awesome. Thank you so much. So we're gonna take a question from the chat, and I think this would be a great one for Dr. Baillie because it's about specialty, and I know she did a little bit of work with contact lenses and specialty in that sense. So for you, Dr. Baillie, what is the best way to learn a specialty after school if you do not want to do a residency?
Mm. This is a good question, and I did not do a residency. There's a couple of reasons why that was the case, and we can talk about the differences in the way that residency is recognized in Canada versus the States, but I really don't think that's the root of your question. So regardless, there's a couple of ways that you can explore a specialty area of interest, and I think that's really important that you do that if you want to do that in addition to primary care, or even instead of primary care as an optometrist here. With specialty contact lenses, it's a little bit of a different answer than it would be for something like vision therapy or low vision, because in specialty contact lenses, you have access to consultants and you have access to resources like the Gas Removal Lens Institute, where they have all of these resources dedicated to new graduates, teaching you kind of from the ground up really how to fit and handle these lenses. So if you're interested in specialty contact lenses as a new graduate, I would really encourage you to get your feet wet and let the consultants do some of that work for you, and learn by watching what they want to change and what they want to do with your patients, just given the information that you provide them. So call yourself a data collector first, and then once you know what to do with that data, it becomes a little bit more second nature with experience. Secondly, continuing education credits are a great way to gain experience in your desired specialty. And even as a new graduate, I can't imagine any other fellow provider, especially a specialty provider, saying no to asking to shadow for a day, or asking for a mentor. So networking can go a really long way in this respect too, but I am living proof that it's absolutely possible to practice in a specialty without doing a residency, and I think it's important that we do that in Canada.
Awesome. Thank you. Sorry for putting you on the spot with that one, but great question. Okay, let's go back to Dr. Scott here. Another question in the chat. What is the status for boards? We used to be able to practice in Canada without taking Canadian boards and just taking NECO, but this person heard that it has changed. Can we get a little bit of clarity or insight from your perspective?
Yeah, so it did change last year that if you had registered for the MBEO you're able to complete that pathway, which is great to support those who are partway through. But if you hadn't, you can only now do the OABC exam going into Canada. And, we have a Canadian exam is important. And certainly being I think, in school during that change is certainly can be scary because all of a sudden it sort of changes your path. So we understand that. But it really, I think, is important going forward, just having the Canadian exam. But we have someone with us from OEBC who's going to be able to give us some insights and support. So know that there are supports there for all Canadians, not just the Canadians in school in Canada, that there'll be support there for you as well. So yes, it's just the OEBC at this time. But there's the supports there to help you with that exam as well.
Awesome. Thank you. I know that's a hot topic right now and lots to be covered on that later. I'm going to follow up with another question for you, Dr. Scott. So this person says, if we're planning on practicing in the US first and then going to Canada later, do we register for license in Canada right away, or should we wait till we're back in Canada to apply?
That's a really great question. And I might maybe do some research and get back to you on that. I would say with the board exam change, you may want to do the Canadian boards at the same time. And I think I might punt that one to our person from OEBC on how long those are available, your scores are good for. So I'm not sure. So let me look into that for you.
Awesome. Thank you. And then another question for Dr. Baillie. How did you go about finding a job after graduation? And did you factor in your interest of specialty contact lenses when you were on this job search?
Great question. And I think this was top of mind for anybody in their last year of optometry school thinking about their next steps after graduation. Around this time last year, I was in the exact same boat. So I gave myself about 4 months before I really started to look earnestly at some of the opportunities and think more critically about where I wanted to go from here. And I will say that a lot of the corporate optometric entities do a really good job of putting their opportunities in front of students. It can be a little bit harder to find those private practice opportunities if that's where you see yourself. But I would start with alumni job boards. Perhaps your school offers something like that. Even going around your hometown or wherever you want to practice and hand delivering some resumes went a long way for me in connecting me with some potential opportunities that weren't necessarily advertised on the internet. And certainly availability of specialty equipment to practice within my niche was certainly something that I was looking for. Dr. Scott is a big reason why I ended up fitting scleral lenses. She's the one who kind of got my feet wet in this whole thing, and we practiced together, if that wasn't said already. But we were lucky to have that specialty equipment, and I don't think that I could practice without that. And so that it was certainly a priority to find someone with access to an ANSEG OCT and a topographer so that I can do my job well.
Awesome. We have some coworkers on the chat here. Love to see it. Okay, the next question is for Dr. Scott. This is kind of a big picture question, but looking ahead, are there any emerging changes or trends in Canadian optometry that you've noticed that recent graduates or optometry students should be aware of when planning to come back to practice in Canada?
I think the biggest question we usually get is regarding scope. And so scope optimization is definitely a hot topic across Canada. We have some provinces that are, I think, pretty close to being able to optimize their scope. But really, this is one of the first times that most provinces across the country are actually now in somewhere along that path. Some are just starting at looking at optimizing scope. Some are really just 30, 40 kilometers into their marathon and they're almost done. But I think that's one of the biggest ones is looking at, what type of scope you want to practice to. I think that would be number one. Every province is a little bit different, but ultimately, as far as like coverage through your medical system. So when you look at Atlantic Canada, for example, Nova Scotia has some public coverage for eye exams, but it's very limited in the other provinces in the Atlantic region, whereas BC has a different system that allows balance billing, things like that. Ontario I think would like to have a better system for coverage. So that's another part too. And there's certainly a lot of conversations you can have around that about, access. Access to care for patients as well. So I think those are some of the things, but from speaking to students, I think scope has always been the number one that people are asking about.
Thank you. And then we'll pass it over to Dr. Baillie. What kind of things should we look for in future job offers? What should we look for and also steer away from in terms of contracts?
There's a couple of different elements that you'll find contracts when you compare them side by side, either agree on or differ on. Some of those include the percent return, if that's included in your compensation package, comparing the numbers by the percentage of how much you get to take home based on what you bill for exams and what you sell in glasses and contact lenses. Certain clinics or companies might offer you a signing bonus. Make sure you're clear on exactly what you're signing up for, and if you leave early, what the terms of repayment might be. Should things not work out, always give yourself an out. Things like a minimum guarantee, especially as a new graduate, I would say that's particularly important and sometimes helpful when you're looking at things like financing a car or even getting a mortgage on a house, just to have a level of income that's guaranteed. Should you need to lend or borrow money in the future, can be useful. And lastly, I would say look for a non-compete and make sure that the radius and the timeline is reasonable for you. When I was looking for jobs and I had some contracts in front of me, I found it very helpful to have a lawyer review the terms of my contract. And even though some of these contracts were pretty standard from bigger companies, we still picked out a couple of details that needed to be refined. So you'll be surprised on what kind of things come up. And also lawyers are very helpful for kind of bringing that legal jargon down to a very understandable person-to-person level so you know what you're signing up for.
Thank you. Okay, we are running out of time, but I think we can squeeze in a few more questions. Let's throw it back to Dr. Scott here. Just a quick question. Is Quebec the only province accepting the NBEO exam right now that you know of?
I believe Quebec has a sort of a different, I think as long as you're licensed in North America, I believe you can transfer to Quebec. So yes, I believe so. But again, I will double check what their status is because things change quickly, and I can get some clarification to send out there. But I know their sort of whole structure is different than other parts of Canada, and there may be a French component that you would need to do a separate French exam that you may have to pass there as well.
Awesome. And then we're going to end on one last question, and I'm going to give it to Dr. Scott. What are the efforts the CAO is taking to advocate for the expansion of the Canadian Loan Forgiveness Program to include optometry?
That's a great question. We are working on it. There's a few avenues that we've been meeting with government and a few organizations that we're a part of. So one is called the EHPC, which is the Extended Healthcare Professionals Coalition. And so that's with physio and all those other groups. So we meet with them to kind of learn how they were successful and sort of maybe clues and helps to get there. But it is definitely something that is top of mind at CAO. It was included in our letter writing campaign. And I was speaking at an optometry event on the weekend, and I kind of told them how the students really did so much better with the letter writing campaign than the optometrists. So that was done through CAO, where it was just a form letter that you could submit to your MP or anyone who was running in your riding in the last election. And you guys really you did great. Like there was so many submissions from students and it was awesome. But that was one of the things that we had highlighted in that to encourage people to go back to, especially looking at the Canada Loan Forgiveness Program, to go to sort of rural and remote areas. So it's a great way to get experience in those areas and also to help care for those patients who access may be a struggle for some of them.
Awesome. Okay, so this concludes the group chat session. Thank you guys so much. This was really helpful for me and I'm sure for a lot of the students. And we look forward to seeing what you guys do in the future. Hope to stay in touch.
Thanks for having us.